Hello, everyone. Welcome to our Primetime Alive program, Stop the Bleed. I'm Vicki Newell with Primetime Alive. I think I know all of you. So glad that you came out today. Was it bad getting here because of Ragbri? No, I didn't think it would be. Coming in on the south side of town, I think a lot of it will stay kind of down that way, and maybe, some still won't be getting here till later in the day. However, if they were smart, they would come early in the morning, right, when it's not quite so hot. So, well, thank you all for coming out today. So we're just going to jump right into our program. We don't have anybody joining us online because this is a hands-on presentation. For him, Dustin will be demonstrating, and so it just doesn't do well when we do it online. So you're here and get to see it firsthand. And if you have a question about something that Dustin's talking about or demonstrating, raise your hand. We can address the question then. All other questions will hold off till the end of the presentation. All right, so our presenter today is Dustin Drazy. Dustin has been a paramedic here at Mary Greeley Medical Center since 2013, and he is currently the clinical resource paramedic. Please welcome Dustin.
Good afternoon. Can you all hear me? I kind of hear myself, so good sign. Thanks for having me. I apologize. I don't normally dress like this, but as you know, it's like 90 degrees out, and I've been running around down at Ragbri, so I'm in my special event attire. Normally, I would be a little more dressed up. Again, thanks for having me, and as Vicki said, I'm going to talk to you about Stop the Bleed. Stop the Bleed is a curriculum that came out about 10 years ago, the time I was getting into the profession, and this came about in the wake of the Sandy Hook school shooting, which we all know about, have heard about, and basically that event, it was not the first of its kind. It was obviously very high profile, but it kind of pushed our federal government and many organizations that deal with trauma, medicine, first responder organizations, things of that nature, to get together and look at what could be done to mitigate some of the loss of life and some of the injuries in these intentional mass casualty incidents that we see. So these attacks that include a lot of victims where a lot of people die. And that's kind of what kicked this off. So the organizations you see on the screen, National Association of EMTs, Committee on Tactical Combat Casualty Care. So we have military, we have feds, we have American College of Trauma Surgeons. They all got together to see what could be done. And they studied a lot of things. They looked at prevention, they looked at response, they looked at the healthcare system's response, they looked at the public safety system's response. So this is just one thing that came of that program in that group, which is called the Hartford Consensus. And basically they looked at the people that were dying in these incidents. Sandy Hook, the Boston bombing was another big one, the Marathon bombing. And they looked back as far back as Columbine. And what they determined was that a lot of the people that are dying in these incidents, they're not dying immediately. So there are people that die immediately, they're injured, and that injury is incompatible with life and they're immediately dying. But there was a lot more people that were being injured and they were bleeding, and they were dying because they were bleeding, not because of the injury itself. And those are preventable deaths. Bleeding is a preventable death if you know how to control it until help arrives or until that person gets to the hospital. So that's where Stop the Bleed came about, because it's really easy to control bleeding if you just know how, and if you just know what is life-threatening bleeding. So that's the point of this course. This is for everyone. It's not just for healthcare people. We kind of already knew this. This is for the people that are there when something like this happens. Now, that being said, this is everyday stuff too, okay? We hear about the mass shootings, the bombings, things of that nature, but these are everyday things as well. I've seen people at lumber yards that get an injury that causes life-threatening bleeding. I've seen a person fall off just a little footstool and fall through a window and lacerate their arm and had life-threatening bleeding. It happens in car accidents. It can happen anywhere. It's not just the big scary things we see in the media. This is everyday life. So it is beneficial for everyone, because the person that is there in the moment when this happens is the person that has the power to save that person's life. 5 minutes later, when the ambulance gets there, might be too late. So the people that are there are who can truly save a life. And that's the point of this course. So I'll teach you how to recognize life-threatening bleeding, which is the first step. A lot of people don't know that. They've watched too many movies and they don't know what life-threatening bleeding is. And then we'll teach you how to respond to it. Just the nature of this, there's some graphic images in here, so I'll do my best to warn you when they're coming up, but just be prepared. You might want to look away if blood or injuries of that nature make you a little squeamish, so just warning on that. Like I said, these are everyday things. We do see the we don't hopefully see many of the mass shootings. We hear about them in the media. But like I said, a lot more common that this would be an everyday thing. That's where I've seen it, is in the everyday incidents, something that could happen to anyone, anytime. So the principles of our response if we are a bystander in this kind of thing. So first, we want to ensure our own safety. I'll talk a little bit more about that. We'll talk about the ABCs of bleeding. So in healthcare, we like to make things kind of simple, little mnemonics, something cute that we can all remember. I don't know, the ABCs of bleeding, hard to remember. It's not as good as like airway, breathing, circulation, but we'll talk about them and relate them to the treatment we're going to do. So safety. You can't help anyone if you're putting yourself in a dangerous situation, right? The principles you're going to learn have to be used in a safe environment for you. So just keep that in mind. If it's a dangerous situation, don't go rushing into it. Even if it's a matter of entering a roadway, a traffic accident, don't put yourself in danger. Because if we have 2 victims, obviously the second victim can't be a responder. So keep yourself safe first and foremost. You can't help if you just become another victim or another patient. If you feel threatened at any point in your response, make sure you leave. Okay, that's important too. Safety is constant, it's evolving, and in these situations, it's obviously evolving too. So your own safety, always first and foremost. And then, of course, when we're talking about blood, we want to keep other people's blood and fluids off of ourselves. We want to be cautious about bloodborne pathogens and things of that nature. So just be cautious. If you probably don't all carry around like nitrile gloves like I do, being a paramedic. So keep that in mind. Just try to keep other people's blood off you and avoid any kind of infectious diseases for yourself. So the ABCs of bleeding. The first one is alert. Okay, so like I said, the skills you'll learn here are what is going to immediately save that person's life. They still need to get to the hospital. We still need to be calling 911 because ultimately someone with life-threatening bleeding is going to need surgery. They're going to need to go to a trauma center and they're going to need to go into a surgical suite to permanently repair that injury. What we're doing is the immediate life-saving care and it's not definitive care. Okay, so the A, alert, is call 911. Obviously, part of that is knowing where you are, where the help needs to come, and what help needs to come.
Dustin, can I say something really quick?
Yeah.
So I'm realizing, and my apologies, I didn't know you would have such a beautiful PowerPoint. And so I think people are feeling like they have to take a lot of notes. Do you mind sharing that with me when
Absolutely
you're done?
not.
And I will
Nope.
make it into handouts and I can email it out to everybody after the presentation. So take some notes, that you need, but know that I will send these slides to you.
Yep, absolutely. I will get that to you all. So yes, alert, call 911. Tell them what resources you need. If this is incidents of violence, obviously we need law enforcement coming to mitigate that aspect of things. But also you need to alert that an ambulance is needed, people are hurt. Okay, so all those components. I don't know if any of you have ever called 911 before, but the dispatchers will ask you a lot of questions. And while that might seem frustrating in the moment, it might seem like they're not worried about what's actually going on. That is their job. They have a lot of stuff going on behind the scene. They're asking validated questions that are written by public safety telecommunicating professionals, by physicians. That's a validated system, and it's part of how they get the right resources to you. So do your best to be patient with them. I know it can be frustrating, but answer those questions, and they'll be able to more effectively get help to you, okay? So A is for the alert, call 911. Now the B is simply bleeding. Bleeding, easy enough to remember since that's what we're talking about. The focus of this, though, is we want to find where the blood is coming from, and we want to identify if it is life-threatening bleeding, okay? So even me in my shorts and t-shirt, if I'm bleeding, we need to find the exact source of it, right? So those clothes, if possible, we need to at least move them out of the way and find the cut, the puncture, wherever that blood is directly coming from, because our treatments, as you'll see, are focused on the exact location, okay? Close is not really good enough in this situation. We need to find the exact source of the bleeding, and there might be multiple sources of bleeding, so we need to find and make sure we're not missing one, because if we miss, we got 2 holes where blood's coming from, we only plug one, that's obviously not going to be good enough. We need to find every source of the bleeding. So remove the clothing or at least displace it temporarily to try and find where that blood is coming from. Now, life-threatening bleeding. What is life-threatening bleeding? It's not like the movies. Good guys fighting the bad guys, takes an injury in the arm, has a little blood. No, it's just a flesh wound and they're back in the fight, okay? Life-threatening bleeding can be from anywhere on your body. And it doesn't matter how non-vital of an area that is, okay? So what we want to look for is spurting blood. So blood that spurts rhythmically out of an injury, which we might have seen in movies before, or hopefully not, but maybe in real life. So yeah, spurting blood, that's very bad. It's an artery. There's a lot of pressure there, and that blood is going to leak out. You're going to lose all your blood volume very quickly in a matter of minutes if we don't control that. So spurting blood is a big thing we want to look for. Sometimes it's spurting across the room. Sometimes it's just light spurts, but any kind of spurting rhythmic escape of that blood. Secondly, blood that just doesn't stop coming out, which seems kind of obvious, right? But if you're looking at it for a couple seconds and blood is just constantly pouring out of that wound, that is life-threatening. If it doesn't stop, if it hasn't stopped within a few seconds of you seeing it, it's probably not going to stop on its own, and we need to do something about that. Blood that pools on the ground is another sign. If it's forming a puddle or a pool on the ground, then that means it's enough blood to constitute a life-threatening loss of blood. Now, obviously, the type of surface you're on is going to influence that a little bit. If you're at the grocery store and it's the concrete or tile floor, that pool is going to form a little bit quicker. It's going to look a little more dramatic, but if it's made a pool on the ground, that's life-threatening. If you see it pooling on carpet or like short grass, that's even more alarming because that carpet now is not even soaking up the amount of blood. So pools of blood on the ground. If clothing is soaked in blood, that's a bad sign. And it's not the same to have like a small amount of blood and it's just kind of stained like a white t-shirt. But if that clothing is sopping with blood, even if it's just a little thin t-shirt, then it's life-threatening, okay? Same like soaking the carpet. If it's soaking through blood, it's life-threatening. We need to get that clothing out of the way and find where that blood's coming from. Same thing with bandages. If someone has piled a bunch of bandages on it, which is pretty common when we arrive, that people would have tried to bandage that up. But if that blood's soaking through those bandages, that's life-threatening as well. Kind of the same principle as the clothes. Anyone that's lost part of or all of their arm or leg, they're going to have life-threatening bleeding, okay? And a phenomenon that happens is that those arteries and veins can kind of shunt and suck up into their what's remaining of their limb. And there might not be bleeding right at first, but those will relax and that blood will start coming out. So if we see an amputation or a partial amputation of an arm or a leg, that's life-threatening bleeding, and we need to treat it with the methods we're going to learn next. And the last one, if someone is bleeding and they've become unconscious or they start to become confused and not act their normal self, we need to assume that's life-threatening bleeding, okay? They've lost enough blood that they're not getting blood to their brain, and they're going to continue to deteriorate at that point, and we need to stop that bleeding, okay? So pooling, spurting, nonstop blood that soaks through clothes, and then loss of consciousness, loss of mental status, and partially or fully amputated limbs. All signs of life-threatening bleeding. So there's our graphic image for the day. I apologize for not giving a warning. So that's a good example of a cadaver with spurting blood. That's a really steady stream of arterial blood. The times I've seen it, it is more rhythmic. You get a spurt here, a spurt there, but that is a really good example of arterial bleeding. The picture on the left is just such a deep wound that there's gonna be involvement of those arteries and veins. It's essentially, that's a near amputation. That limb's not hanging on by much, but then you can see the soaked bandages and blood, cloth in the background, okay? So some examples of those types of injuries. So the wounds that the wound patterns that we see that lead to life-threatening bleeding. So one of the most common ones that gets ignored, they saw this a lot in the Boston bombing, are the arms and legs, okay? So extremity injuries. And again, we see this in the movies. Someone takes an injury to their arms or their leg, they're, I'm fine, and they get ignored. And that happened at the Boston Marathon bombing. People were injured. They walked towards the rescuers. The rescuers saw them walking. They saw them bleeding from the arm, and they're like, okay, you're fine, you're walking, continue on. And they took a couple more steps, and they lost consciousness or they died after those couple steps because they had arterial life-threatening bleeding from their extremities that got ignored. So arms and legs, definitely a source of life-threatening hemorrhage, and it's the most preventable one. It's the easiest to treat, honestly. So we can, and we'll talk about this in a second, but we can control that with direct pressure or a tourniquet for those extremity injuries, direct pressure or a tourniquet. Our next ones are what we're going to call junctional injuries. These are a lot harder to treat. And you can imagine, we have big arteries in our neck supplying blood to our brain, but we also have arteries in our armpit area and our groin area. Okay, we can't put a tourniquet on those. And if you think about those areas, it's soft tissue. There's not bones, there's not joints, and it's a little harder to push on those types of areas too. So the junctional injuries, the neck, armpit, or groin, those are areas of life-threatening bleeding, and they're kind of vulnerable areas because they're all that soft tissue, and the arteries can be deep down. So the source of the bleeding can be kind of within our body if we see it in those areas. And so that's gonna mean we're going to control it in a different way, which again, I'll show you in the coming slides, but that's going to use direct pressure, which is the same, or wound packing, which is another technique we'll show you. And then the other area we're going to talk about is torso injuries. These are more common or more likely to lead to an immediate death type injury, although we can see life-threatening bleeding coming from those areas outside the body as well. But more frequently, that's going to be a cause of internal bleeding, which means that person just needs to get to the hospital. There's a lot less we're going to do for these people. They need surgery. They need rapid transport. These are the people we might be calling a helicopter for, and flying them to Des Moines or Iowa City. But, so torso injuries. We could also lump head injuries in there as well. They're not going to be a good candidate for bleeding control. They're going to be more focused on rapid transport to a hospital for surgical intervention. But it's still important that we identify that that's the source of the life-threatening bleeding, right? We need to know that because if they are still alive, they're going to be a rapid transport for us. They're going to be one of our higher priority patients, knowing that we can't necessarily stop their bleeding in the field, especially if we have a lot of patients. If it is kind of a mass casualty thing, if we have 5 or more patients, we can treat the arm injury on scene. We can put that tourniquet on and prioritize them for a little later. These people need to go first. So kind of an algorithm for how we're going to treat this. So we're, again, building on the airway, or the airway, see, I did it, the alert and the bleeding. So again, you're making sure you're safe. We want to find that life-threatening bleeding, and we want to know if we have the equipment, the bleeding control equipment available. As you came in, you might have saw the AED out here by this entrance. Below that, there's a bleeding control box. There's not stuff in it yet, but we have the stuff ordered, and So there will soon be bleeding control kits available right here in Mary Greeley. They'll be throughout the hospital. I challenge you to look when you're out in public. If you see an AED, see if there's a bleeding control kit right next to it. These are increasingly common in our community. So while you might not have the equipment on you right now, these are things that are publicly available. So it's something to think about and consider. You can even go buy the stuff, which we'll talk about in a second here. So, is a trauma first aid kit available? So we're going to pretend that in this situation, no. So what do we do if there is no trauma kit available? Well, this is easy. We're going to apply direct pressure, but we can use any sort of clean cloth or gauze. They say clean. I'm going to stretch the boundaries of that. I always tell people, if you have an extra shirt on, if you have a scarf, heck, if you have a dirty sock, you can take that off and you can use that to apply direct pressure. Towels work really good. Bed sheets, things of that nature. We can apply direct pressure with those. So find that cloth, cleanish cloth or gauze, and then we're just going to find the source of the bleeding. Like I said earlier, we're going to identify where that blood's coming from. We're going to take our cloth, we're going to put it on the source of that bleeding, and we're just going to apply direct pressure. And we're going to lean on that injury. We're going to push with both hands if possible and hold that pressure until help comes. Okay? It's really that simple. It's really easy. Anyone can do it. You need very little special equipment. Like I said, if you have that extra shirt, a towel or something, that's going to help. That's going to soak some of the blood up and we can get that pressure down in the wound. But direct pressure with just your hands is going to be fine too. Any kind of compression or any kind of pressure, because we want to push on those veins. We want to push on those arteries. We want to compress them down and keep the blood from leaking out of that injury. Okay. This is going to be effective in most of the injuries you could possibly see. Okay. Someone with a laceration on their arm, their leg, direct pressure is probably going to work. Okay. It's at least going to work until we can get there and do something else. Even on a complete amputation, direct pressure might not control all the bleeding, but it is going to slow the bleeding enough to buy that person time until we arrive. When I was brand new, I wasn't even a paramedic yet. I was still in school. We had a person wreck their motorcycle and they lost one of their legs immediately in that wreck. And just a nurse in her car saw it happen, stopped, got out and held direct pressure on that amputated leg. And it saved that person's life until the ambulance could get there and do more effective direct pressure. I saw it recently at a call at a lumber yard. Gentleman got stabbed with some equipment in the arm, had arterial bleeding, and his coworkers just put bandages on the arm and held direct pressure. Saved his life. It no doubt saved his life. Just direct pressure. They had no special equipment, but they saved that man's life because they saw that it was life-threatening bleeding and they put direct pressure on it until we got there. So again, it's simple. You need no special equipment and it is life-saving. The biggest thing is hold that pressure until help comes. It's not going to stop bleeding. It's not a paper cut. It's not going to clot itself off if you hold a little pressure. They need to go to the OR. They need to have surgery, and we need to maintain that pressure until someone else gets there to help. Okay. So we don't want to check to see if it stopped bleeding because it's just going to keep bleeding. So don't worry about checking. It's not going to scab over. It's not going to clot off. Just hold that pressure until help gets there. So this gentleman conveniently had an extra shirt on over his hoodie, which I think is weird. But whatever. I don't know. Not judging. I don't think he probably had that just for the picture. But he took his extra shirt on and he's going to use that as direct pressure on that bleeding leg. So you can see exactly what he's doing there. He might, if it's a deep enough wound, you can even stuff that cloth down into the wound if it's a big gaping wound. But he's using that shirt to hold direct pressure. And it's potentially going to save her life. So we've got a video. When they first started this course, that part of their campaign was they were giving out these red shirts that said this shirt can save a life. And that was kind of their point with it. You could literally take the shirt off your back and use it to apply direct pressure to an injury. So she's found the source of the bleeding. She's taken her life-saving shirt. And you're going to see she's going to tuck it down and kind of poke it into that wound a little bit. I guess she didn't do it as much as I thought. But she is, I mean, you can see her kind of quivering with the effort. She's holding that pressure, and it's not easy, especially if we have an arterial bleed, so that artery with all that pressure in it, we really, really, really have to hold that pressure down really, really hard to keep those arteries collapsed. So it's not easy. It's going to be hard work for the few minutes you have to do it. Yeah, question.
What if you suspect there might be a broken bone underneath?
Yeah, that's a good question. So she asked if, what if you thought there was a broken bone under the injury? And that's a good point. And I'm glad you brought it up. This is going to hurt them. It's going to cause them pain. They're going to scream. They're going to shout. They're going to beg you to stop. And in this moment, we're not super concerned about that broken bone, about causing further injury, because it might cause further injury to their bone. But we need to keep that blood in and save their life. The bone will get fixed later at the hospital. It'll be surgically repaired, but we need to keep them alive to get to that surgery. So that's a very good question, and it's a barrier for a lot of people that aren't medically trained, because you start doing what you've been taught, that life-saving intervention, and then someone screams, "No, please, please stop!" The time I remember putting a tourniquet on someone, this man was begging me, and he was like a young, tough, tattooed, muscular guy. He was begging me to take the tourniquet off. It hurt so much. You just got to explain why you're doing it and kind of advocate for him and say, "Hey, this is keeping you alive."
What about when you come up on a compound fracture?
So he asked about a compound fracture. So if a bone's sticking out of the body, if there is blood coming around it, you just want to do your best to avoid those bone fragments if we have ends of the bone sticking out. So another good question. It's possible those can be sharp and they can hurt you. So that's kind of goes back to keeping yourself safe. But if you can pack or put that cloth underneath the bones or to the side of the bones, just the best you can do to keep that pressure on there. When we get there, if we see that kind of thing, we're going to pull the leg straight, get the bones back in place in that situation, but do the best you can in that situation until we get there. Yep. Any other questions about that before I move on? Cool. Okay. So we're going to talk about what you do if you do have a trauma first aid kit, if you do have the trauma first aid kit now. So our next step after that is, where's the blood coming from? So we'll say now that it's coming from the arm or the leg, so one of those extremity injuries, and I kind of alluded to this. If you have that trauma first aid kit, hopefully it has a tourniquet in it. If it doesn't, it's not a good trauma first aid kit. Okay, so if there is a tourniquet available, we are going to apply that tourniquet. So applying a tourniquet. And I'll have these down here, and I can come up to you with some examples of the tourniquet when we're done, because a big part of this is practicing with the tourniquet. Really, it is. But this is a tourniquet. This one is called the CAT. That does not mean it's a tourniquet for cats. The kids love that when I talk about that. It stands for Combat Application Tourniquet. So this came out of the military, widely used in the military and law enforcement and paramedicine on the ambulance. Really, really good tourniquet. So Combat Application Tourniquet. The hallmark, I always talk about this because it helps understand how and why we use them. A good tourniquet, and there are bad tourniquets, which we have a slide about that later too. A good tourniquet is going to have a couple features. It's going to have a band, always, not like a rope or anything like that, but it's going to be a band that's at least 2 or 3 inches wide. And within that band is another band, okay? So it's going to have a band. It's going to have this rod right here, which is called a windlass. And then it's going to have hooks for the windlass. So when we go to apply the tourniquet, we want to find that source of the bleeding, and we want to apply the tourniquet above the bleeding. So if I'm bleeding at my elbow, I want to go 2 or 3 inches above it or closer to the heart. Okay, so between the heart and the injury. I want to put that tourniquet on. I want to tighten the band first, and all good tourniquets are going to have a band that you can just manually tighten initially. And I already did this wrong because I can't get to it. Tighten it really, really tight. A lot of people don't do that correctly. They leave it kind of loose, but as tight as you can before you even go to that windlass. So get that tight. We're going to take that windlass and we're going to just twist it as many times as we possibly can. And like I said, it hurts, so I'm only going to go once because I don't, it would hurt too much to go twice for me right now for a demonstration. So hook that windlass in, and it just connects right in those hooks. There's one on either side, so it doesn't matter which direction you turn it, just as long as you let it hook in on its own. We're going to loop the rest of that extra Velcro around, and then they all have a little time tag on them, and it's white. And if you have a Sharpie like I do, you can write a time that you applied the tourniquet on. Okay, so 2:30. I would write 14:30 on there, and then when they get to the hospital with the tourniquet, they're going to know how long it's been on there. So that's how we put a tourniquet on, and we want to tighten that. I say as many times as you can turn that windlass, just turn it as many times as you possibly can. But our goal is that the bleeding would stop, obviously. So we got to watch that source of the bleeding and tighten that tourniquet at least until the bleeding stops. So people ask what happens if you tighten it all the way and if you tighten it all the way, but the blood is still coming. Well, you can put a second tourniquet on. So a good trauma kit, again, will have at least 2 tourniquets. So if we talk about like an amputated limb, it's pretty common that would need 2 tourniquets to stop the bleeding, especially below the leg or on the leg. Yeah, so put the one tourniquet on, tighten it until the bleeding stops. If that's not enough to control the bleeding, throw another one on and control it with 2 tourniquets. You can always do that. So ideally, we want to go 2 to 3 inches above the wound. If you can't immediately find the source of the bleeding, the other thing you can do is go high and tight on that limb. So right up next to the shoulder, or if we're on the leg, right up next to the groin, essentially. The thing to keep in mind, we all have stuff in our pockets. If you have things in your pockets, even like a pen or a pencil or something like that, that's going to prevent that tourniquet from effectively controlling the bleeding. So just remove anything from the person's pocket before you put that tourniquet on. Okay. So this is kind of what I just explained. Another picture of a tourniquet. So they've got it just that 2 to 3 inches above the source of the bleeding. There's still no blood coming out, so they've done it effectively. And that's just going to compress all that tissue and compress those blood vessels so blood can't come out. Okay. The other thing, we don't want to be on the limbs, or I'm sorry, on the limbs, on the joints. So we want to stay off the knees or the elbows because it's not going to compress the tissue there if we tighten it down. So right away, if you see life-threatening bleeding from an extremity, go ahead and put that tourniquet on. It can go over clothing. Like I said, just make sure there's nothing still in their pockets, okay, because that's going to get in the way. I think I said all this. Yeah, tighten it until bleeding stops. So there are several high-quality tourniquets out there. The CAT, or the Combat Application Tourniquet, is probably the most widely used one. This is a little older slide, but there's one called the Special Operating Forces Tactical Tourniquet, or the Soft T. That's a pretty good one. And there's actually a lot more of them out there. The hallmark for a good tourniquet, though, is that it's approved by the Committee on Tactical Combat Casualty Care, which is a joint venture between the military and the National Association of EMTs. I will say, I recommend the CAT tourniquet if you want to go buy one for yourself, which I also recommend that you go buy a tourniquet for yourself. I have one in my pocket. I have another one in my car and one in my work bag, and I give them as presents to my family on Christmas time. They don't really enjoy it, but I give them a little impromptu bleeding control class and a tourniquet, and hopefully they never have to use it, but I'm sure they'll appreciate it if they ever do. So they can thank me then if it ever comes to that. But for now, they're going to continue getting boring tourniquet Christmas presents. But yeah, go buy one. They're affordable, $30-$40. They're not much more than that. And if you ever have to use it, it's invaluable at that point. And if you never have to use it, you paid $30 to have something the rest of your life that you never used, but maybe gave you a little sense of security. Yeah, question?
Where would you purchase tourniquets?
Yes, so where you purchase them is important. If you're going to get a CAT tourniquet, I would get it from a company called North American Rescue. They're the primary distributor of CAT tourniquets in the U.S. So it's North American Rescue, and I think their website is narescue.org. I would just buy them straight from there. It's a good, reputable source. Don't buy them on Amazon. There are tons of fake cat tourniquets that look like real cat tourniquets. You only find out they're fake when you try to apply them and the windlass breaks or the cloth rips or some piece of plastic breaks, and then the tourniquet doesn't work. So North American Rescue is the site that I recommend to everyone. There's the cat tourniquet. I kind of pointed out those aspects of it already. And then we got a picture of someone applying it, like I recommended there. The other thing about these is you saw me do it. You can self-apply this. So it only takes one hand to apply a tourniquet, and that's by design because they're widely used in the military, and they see those type of injuries where an arm is incapacitated. So you can self-apply those tourniquets, and that is intentional. So yeah, we're going to put the limb through the loop of the tourniquet, 2 to 3 inches above the side of the bleeding. We're going to pull the band really, really tight. You got to remove all the slack. And again, I can't reiterate enough. This is where people mess up and the tourniquet fails, quote unquote fails, is that they don't pull it tight enough to start with. Okay, that windlass isn't going to pull all the slack out if you leave any slack in that tourniquet. Adhere the Velcro. Twist the windlass until the bleeding stopped. I just tell people as many times as you can. It's far more common that they would be under tightened when we arrive. Lock it in place, fold the rest over and secure it and write the time on there. I always say that's one of those things I'm going to forget in the heat of the moment. And the one time I have applied a tourniquet in the field, I forgot to write the time on immediately. I remembered, went back and did it though. So we got a video here. So she's starting with the tourniquet all the way unlooped. So she's going to have to go and put that red end back through the buckle. So she's inserting that through. She's going to pull it really, really tight. If I remember correctly, this guy's pretty tough, and she turns it like 3 times. I would have to be bleeding to let someone do that to me. Okay. That still is enough to hurt. She's tucking that out of the way. I always say we don't want to leave too much of that like dangling, because if it gets caught on something, or I'm clumsy, I would trip over it and pull the tourniquet off. So just make sure that extra is out of the way. Fold that tag over and write the time on there. And it's that easy. Now, this guy's got a lot of clothes. He's got long sleeves on. Those would be soaked in blood. She might want to go all the way up here if she doesn't know exactly where the blood is, and that's okay. That's okay. As long as you get that on and stop that bleeding, we can move the tourniquet closer later when we get there. So some key points. This is safe, okay? When I started in EMS, we didn't use tourniquets, because people were going to lose their limbs and we were going to make people lose their arms and get their arms cut off. But if you think about what the alternative is them bleeding to death. And they actually have shown that you've got a really long window before you're definitively going to lose that limb. They use these, like I said, a lot in the military. So a lot of the studies come from the military, and the military is a lot of young, healthy guys. But they don't have a single documented case of someone losing their limb or having any permanent damage if that tourniquet was left on less than 2 hours or less. So there's at least a 2-hour window where this isn't going to cause any permanent injury to their limb. If it does cause permanent injury, well, they survived to live with that permanent injury, and I would think that would be preferable. A lot of people ask about improvised tourniquets as well. Can I take a blanket or a towel and put a stick through it and twist that tourniquet on? Can I use a belt? You can. There's a couple problems. They're difficult to make. It takes a lot of time to get all that equipment together and to apply it correctly. And the other problem, and they saw this a lot in the Boston bombing. People were taking their belts off and using them as tourniquets, and they'd pull the pressure, they'd stop the bleeding, and then they think they had it taken care of, and they'd walk away. Well, guess what happens when you let go of the belt? the pressure comes off and the bleeding just starts again. And those people were dying because they were getting the pressure, they were getting left. People thought they were treated, and they walked away and they kept bleeding again. So we don't really want improvised tourniquets. What do we have in the absence of a tourniquet? We have our hands. We can do direct pressure, and that's going to be way more effective than an improvised tourniquet. And again, if one doesn't work, apply a second tourniquet. So an image of someone with two tourniquets on. So like I said, no tourniquet has caused an amputation if left in place less than 2 hours. We still want to get them there quickly. Okay. And a lot of people, this window can be out to 5, 6, 7 hours before we think about losing that limb. So they have time. They have time. When they're at the hospital, they have other techniques they can use. They can do internal wound packing, put balloons and expanding gauze in there, things of that nature. And then they can take the tourniquet off. So the thing is getting them to the hospital quickly, but don't let that discourage you from using a tourniquet. And again, that danger is secondary to saving their life. We want to save their life first, and we can worry about the limbs later. If you do have a training tourniquet, or if you go out and buy a tourniquet and you want to practice with it, have a second one. Once the tourniquet's been used and practiced with, it loses some of it, gets stretched, it loses some of its tension, and it's not going to be effective as a real tourniquet. So keep that in mind. Like I said, they hurt, and they hurt a lot. I will anecdotally say that the gentleman I put the tourniquet on fairly recently, that is top 5 most pain I've ever seen a patient in 10 years of doing this. Top 5 most pain I've ever seen in a patient. It hurts a lot. But it's a pretty compelling argument. Sir, ma'am, I know this hurts, but if I don't do this, you are going to die. That seems to get through the pain. That cuts through that a little bit. So it's a compelling argument. Just make sure you explain that to them. They'll want you to take the tourniquet off, okay? Don't let them. They'll try to take the tourniquet off in some cases. Again, don't let them. And just because it hurts, that doesn't mean we did something wrong, okay? Doesn't mean you did something wrong because the tourniquet hurts. It's supposed to hurt, okay? When we get there in the ambulance, we'll give them medicine that will take the edge off that pain and treat that pain, okay? Just keep them alive. So some common mistakes. People are reluctant to use the tourniquet. They don't think they need to. They're afraid it's going to hurt the person, and they just kind of hesitate in the heat of the moment. You're better to put it on and not need it than to not put it on when you do need it, okay? It's very time sensitive. Sometimes that hesitation is enough to put that person over to the edge where there's not anything we can do for them at that point. Again, not using a second tourniquet when needed. They think, oh, the first one didn't work. I must have done something wrong. And then they hesitate to put a second one on. So as many tourniquets as you need to stop the bleeding, okay? Loosening it is a mistake. We don't want to loosen it to ease the pain or to check if the bleeding stops. Once that's on, leave it on. They will take it off at the hospital, okay? Because if it's life-threatening bleeding, we loosen that tourniquet, they're going to bleed more, and even a little bit at that point can be enough to cause death. And then just removing a tourniquet. That's a mistake. Once it's on, leave it on. That's okay. We're not going to give you a hard time if we think you put it on incorrectly. That's not going to happen. Questions about tourniquets before I move on? Yes, Betsy.
Can these tourniquets be used on small children?
Yes, so she asked if the tourniquets can be used on small children. So infants, toddlers, they might be a little small for them. And I think I actually have a slide about that. That's a common question. There are some kids that are just too small for the tourniquet to work on. If it's too small, we'll just use direct pressure. But if the tourniquet fits on them, it's appropriate to use it, okay? And they're gonna fit everything but, like I said, the infants and small toddlers. School-age kids, these will work on, and that's totally acceptable to use the tourniquet. Yep, absolutely, good question. Any others? Yes.
This isn't about tourniquets, but if you have someone who's lost a limb or a leg, is there a possibility there's more than one blood source?
Yes, so she asked, oh, did I cut you off? I'm sorry. Okay. So she asked if someone's lost an arm or a leg, if there's a possibility that there's other sources of bleeding. And absolutely, that's true. If, though, we tourniquet that whole limb, we're going to stop the bleeding in that whole limb, whether there's multiple vessels involved or not. However, we do still want to look at other injury sources, because if we think about a blast or something like that, it might take the limb off, but there might be shrapnel that's caused bleeding elsewhere. So definitely we want to look for those other sources.
That brings up a question. What about a bullet wound when the bullet is still in there?
So he asked, what about a bullet wound when the bullet is still in there? And, you know, as long as we control that bleeding, we're not worried about pulling that bullet out right now. That'll happen during surgery. So if the bullet's still in there, then that hopefully means there's not an exit wound with another source of the bleeding. So it kind of makes our job easier if that bullet's still in there. So yeah, that's not really going to change how we use these techniques. We can still pack around it. We can still hold direct pressure on it. That's totally fine. Yep. All right. So we'll practice tourniquets at the end. So what if a tourniquet's not available? We can always do the direct pressure, or we can use hemostatic gauze or wound packing, which I'll talk about here in a second. So if we have an injury in those junctional areas, we're not going to put a tourniquet there, right? We're not going to put a tourniquet on someone's neck. It's not going to work if we put it on the shoulder or their hip. So what do we do in that case? And that's where we're going to use wound packing or hemostatic dressings. So the bleeding control kit in the wall up there, that's going to have this. And again, a good bleeding control kit will have this. Hemostatic gauze is, as you can see there, either a roll or like an accordion folded gauze. And they're typically going to be like 12 feet of gauze in a little package like this. And not all of them have this. The really good ones have something called Quick Clot or Keto Flex or Keto Gauze or Cellux. But they're going to have some chemical in them, like imbued down into the cloth, that when it comes in contact with blood, it chemically reacts and causes that blood to clot and congeal. So we're doing a couple things when we wound pack or use a hemostatic gauze. We're pushing that gauze down into the wound, and I have some videos about this, and it's getting pressure down in that injury where the blood is actually coming from. So we're really putting direct pressure and compressing that wound, but it's also causing the blood coming out to clot. Okay, so we're coming at that wound from two different ways. So wound packing, we're going to open our wound packing gauze. We're going to find the source of the bleeding. And again, this is probably going to be in the neck, the armpits, or the groin. We're going to open our gauze, find the exact source, and we're just going to start packing gauze deep down into that injury. Okay? And like I said, this is 12 feet of gauze, and it will all fit in this simulated wound. But I won't do that for the time it takes, just for the purpose of this. So I'm going to pack that wound, and then I'm going to do my direct pressure, just like I did with the towel or the t-shirt or the dirty sock. And I'm going to hold that pressure until help comes. Okay, so that's wound packing. And again, neck, armpit, groin. Okay. So hemostatic gauze is like the gold standard if we're going to do this. However, you can do this with that towel or a bed sheet or whatever. Any kind of cloth you can pack into that wound is going to be beneficial. So I really like this image because it illustrates what exactly is happening. So if we only put that pressure on the surface, we have injuries down in that tissue that can continue to bleed. If we pack it, now we're getting pressure there, and we're getting that hemostatic agent at the source of the bleeding, and it's going to cause that blood to clot. Okay? I kind of talked about that. Are there questions about wound packing? You'll have a chance to practice this at the end too. Okay. So bleeding control in children, we kind of touched on this. same techniques that we're going to use for really anyone, as long as that tourniquet fits on them and isn't too big. The advantage with children actually is that they have lower blood pressures. There's less pressure in the system. They have smaller limbs, so it takes less pressure to control the bleeding, but then they got tiny little arms. We can just encircle their arms with both our hands, and it's that much easier to hold that pressure and that compression on it and control the bleeding. We can still pack the wound just like we would. We can still use the tourniquet just like we would. So not a lot different, other than the fact that you're dealing with a kid and it's going to be distressing for them, and that aspect is going to be difficult. So blood exposure, even if you were wearing gloves, just make sure you wash your hands and clean yourself off really good if you use any of these techniques. We don't want to catch people's diseases they may or may not have in their blood. If you were exposed, like you got blood in a wound or anything like that, go to the hospital, let them know what happened, and get the appropriate medical treatment for that. Okay, that's important. So our summary, make sure you're safe, right? That's always the most important thing. We don't want you walking into a dangerous situation and all of a sudden we have another victim or another patient, right? Because again, you can't help anyone if you're hurt yourself, right? Our ABCs of bleeding, alert, so call 911, get help on the way. That might be police, that might be the fire department, that might be the ambulance. Get the help coming. Bleeding, we want to find where the blood's coming from, and we want to identify that it is life-threatening in nature, and then compress. We're either going to do direct pressure, which we can do to any kind of injury anywhere on the body. We're going to put a tourniquet on if it's an extremity, and we're going to wound pack if it's a junctional injury, so neck, armpit, or groin. Kind of the takeaway of this, again, this is geared at preventing preventable death, or saving people who could have been saved, right? There's only one thing more tragic than death, and that's a preventable death, okay? If something could have been done by someone who knew the techniques to control that bleeding. And that's the point of this course. Could have saved a lot of people in those big, scary mass casualty incidents if the bystanders had known these techniques. So now you know the techniques. Hopefully you never have to use them, but it's really easy to do. It's not easy to be in the situation, to see what you see, or to deal with what you've seen, but the techniques are easy to apply and they matter, okay? I've seen it many times where just a bystander saw someone bleeding and all they did was hold pressure on that injury. But I've seen times too where they didn't know what to do and they just let them bleed. By the time we were there, it was too late. So you know what to do now, and you can save someone by using this. Again, hopefully you don't have to, but you now have that knowledge, you have that skill, okay? Again, so another good source, you can buy these at bleedingcontrol.org. This is the website of the American College of Surgeons, so it is a reputable source. You can buy Quick Clot. The Quick Clot, you can buy this, it is more expensive, and I want to say there's like $50, $60, and they expire every 5 years. So they're a little bit more cost prohibitive, but you can get ones that don't have a hemostatic agent in them. Tourniquets, $30, $40, or you can buy whole kits. There's educational material on there as well if you want to post that in your place of work or church or wherever as a resource. So another good source for buying this kind of stuff. They have wall-mounted ones. I know all the schools in Story County have those, and we're making efforts to go around and teach this in the schools. But you'll see them pop up different places as well. Again, bleedingcontrol.org is a good resource for this kind of stuff. North American Rescue is another good one. And with that, I'll leave it open to any questions, and then we can come practice when questions are done. So,
just raise your hand if you have a question. I'll come around. My question was going to be, do we have them in our schools? So
yes,
I'm
in Story
very
County.
Glad to hear that.
Yep.
Oh, let's see. You know what, Sandy, if you don't mind asking, and Dustin will repeat.
I was going to say, what did you say the website then for the combat application tourniquet was? I know it's CAT initials, but then what?
Yep, so she asked the website again, and it's narescue.org.
And that's for the cat.
For the cat, yep. And you can buy the cats on that bleedingcontrol.org as well.
Okay, thank you.
Yep.
Other questions? It was a very good presentation, Dustin. Lots
Thank
of
you.
great
Thank you.
information. The one thing I'll tell you is Dustin will get this PowerPoint to me and I'll share it with all of you because I should have your email. But if you didn't check your name off and I see I have 18 people here and I only had 16 people check off, the 2 who didn't check theirs off, won't know that you're here, so I won't send it to you unless you stop up there and check your name off or write your name down. I think most of you heard I pulled the wrong list today. So just write your name down on the list and we can get those, the PowerPoint shared out to you. Other question, the thing that keeps coming to mind is I've done, CPR stuff too for the community. And like they say, they're doing something's better than nothing. People are so worried they're going to hurt somebody. Well, if you do nothing, like you said, I like your point. It might be a dirty cloth, but it's something better than just letting them bleed out. You'd rather deal with an infection or something
Yep.
like that.
They'll treat that at the hospital.
Right, exactly. All right. Well, so you have some other, you're going to let people come down and.
Absolutely.
Okay. Well, let me just do my closing quick because I know once this goes, people might have to leave or people will get done at different times. But thank you so much, Dustin.
Yeah,
Great
thanks
presentation.
for having me.
You've come and talked to our department. This was more information. I learned a lot. So thank you. If you guys don't mind filling out the evaluation and giving ideas also for other programs that you would like, and drop those off up in the basket. And like I said, if you didn't check your name off, make sure you write it down if you want to get the handout emailed to you. Our reminder, our next program, we have a little bit of a break here. We have fall risk screenings on Thursday, August 17th. It only takes about 15 minutes, and we're going to have our physical therapists here doing evaluations and giving you some suggestions on things that you could do to improve your balance or other recommendations that they may have. You need to call our office, though, to make an appointment. You can't do that one online. You need to call us. And then next month, we also have a program Tuesday, August 22nd at 2:00 here on sleep and human aging. It's Dr. Clemens. That was his title. I don't know if he was worried people were thinking we were going to talk about sleep and dog aging or something like that, but it's sleep and human aging. And he is a great presenter, lots of wonderful information. So once again, thank you everyone for coming out. Be careful, watch for bikers as you go home. Thanks, Dustin. And anybody who wants to come down and try some hands-on, please feel free to do so.